What you are looking at is 2C's poster presentation, which visually summarises what wins 2C have achieved with the introduction of EOC on our ward. Just to give you a bit of basics about 2C, 2C is a 31-bed surgical unit at Port Macquarie Base Hospital, located on the beautiful mid-north coast of New South Wales. The patient speciality groups include orthopaedics, general surgical, vascular, urology and facio-maxillary. This makes for a busy ward filled with a diversity of patient types. Our patient population is mainly over 65 years of age. Introducing EOC on 2C. EOC was introduced to 2C in 2010. It was a new concept to us and very much a learning curve for the ward. We had 4 facilitators from 2C who attended EOC workshops. We had good support from senior management and from EOC coordinators. So with support from management, EOC coordinators, and by having 2C-based EOC facilitators in place, this provided the opportunity for 2C to readily embrace EOC. Some challenges we faced initially were that some staff did not want to be involved. The busyness of the ward made for difficulty in rolling out the EOC phases, such as observations, patient stories, and clinical audits, and who would be available to do these, and when would we get the time. One important aspect from challenges faced that we do differently is to involve more clinical staff in the assessment phase. So to get the EOC process rolling on 2C, supernumerary time, which was supported and allocated by management, was set up so that ward staff could have the opportunity to bond as a group and to get to know each other, at the same time explore work and personal values. Approximately 65% of 2C nursing staff attended over a 2-day period. Staff indicated that they felt very positive about the day, was purposeful and meaningful in getting to know their fellow staff members on a more personal level. From value clarification exercises, we came up with our Ward 2C vision statement. After value clarification, the ward's next step in EOC preparation was to start to collect assessment data so as to try and capture all the elements of the 9 domains of care. 2C staff collected observations, clinical audits, including IMS and medical record audits, and also patient stories. When we used the CCI tool to make sense of the data, the collected data was critically analysed by ward staff, and staff then reflected on the collected information. All ward staff had an opportunity to have their say at these sessions. CCI provided an opportunity to enable staff to then action plan patient care improvement. One important aspect that did arise from CCI sessions was, as a result of reviewing patient stories, staff acknowledged the importance of listening and responding to their patients, and that care should be planned in consultation with the patient and their family. The 2 patient care improvement initiatives which emerged by using the essential cares process on Ward 2C that we will elaborate on are bowel management and protected mealtimes.
One theme that emerged from the CCI sessions as being a priority for action was to improve bowel management for patients who had elective total hip and total knee replacement surgery. EOC audits had shown that this patient group received excellent opioid pain management, but bowel documentation and management to avert constipation resulting from the opioid use was inconsistent and not standardised. Also, the audit findings provided no evidence that there was any attempts to address bowel problems by medical or nursing staff. As shown in the graph, 64% of the 60 patients audited had not had their bowels open for 3 or more days. As a result of these findings, staff felt that bowel documentation and management needed improvement, and that staff felt they needed clear strategies and appropriate guidelines for managing these patients. So what did 2C do to achieve this? First, we set up a working party to help coordinate the development of strategies, education and appropriate guidelines for this patient group. Some strategies to improve patient care of these patients included the development of a bowel management clinical procedure and standing order for the administration of appearance with opioid administration. The medical standing order from the guideline has been incorporated into the joint clinical pathways. An education program was developed that focused on clinical documentation, guideline support and also bowel management. Pear juice and prunes were introduced to the patient's daily breakfast. Also, in alignment with these initiatives, the joint clinical pathways were reviewed. Changes to the pathways incorporated the inclusion of a daily nursing prompt for pear juice and prunes, a daily nursing prompt to chart bowel actions, a prompt to the pre-admission clinic medical officer to prescribe an appearant for post-op use, and a daily prompt to review the plan of care with the patient and/or carer. All these strategies were designed by having a collaborative process in mind. As you can see, it involves all the patient involved in the patient's care. Further bowel documentation auditing was attended and collated in 2010 and 2013. We have seen a marked improvement in the nursing documentation and management of these patients. There's been a 90% improvement. Audit results showed evidence of increased compliance with documentation practice on clinical pathways, the SAGO chart, and documentation variances in the progress notes, and also an increased compliance in prescribing and initiation of appearance standing orders by the medical staff. Overall, patient care was improved by clinicians identifying and activating localised solutions which were simple and person-centred. However, we cannot be satisfied and complete the care project. Ward 2C is currently reassessing documentation and management practice in regards to bowel management so as to further strengthen and embed this practice into our care process. Okay. The next project focuses on protected mealtimes. Protected mealtimes was an issue that was highlighted to all the inpatient departments at Port Macquarie Base Hospital in 2013. All wards had a directive from senior nursing management to make sure that patients who required assistance with meals were being fed and that staff must adhere to patient-protected mealtimes. The main issue was that patients were potentially missing out on meals, therefore not having access to adequate nutrition and hydration. In order to come up with a solution to address this issue, 2C staff thought it best to use the EOC Claims, Concerns and Issues tool. By using the CCI tool, staff reflected on the issue of patient nutrition and could see that there was a potential risk for patients who required assistance to miss out on their meals. An outcome of the CCI dialogue was that staff decided to try 3 different time options for staff meal breaks that did not impinge on patient meal times. After the trial period ended, ward staff regrouped to discuss the trial options, and the outcome of this meeting was an agreed new change in staff meal breaks so that all staff were on the floor at patient meal times to ensure patient nutritional needs were being met. Overall, it was valuable to use the EOC tool to help attain an achievable solution for what is often an ordered directive from above. 2C utilises EOC tools to turn around a directive from senior management so as to make it work on a ward level for both the staff and the patient. The EOC process enabled our staff to take ownership, to understand and reflect on a problem, and from this we were able to take ownership of a patient care need, which resulted in making a positive change for staff and the patient on the ward. This makes way for a patient care process to become embedded in our ward culture.
EOC has been embraced by 2C staff who are now proud of their abilities to better care for patients, and this change in culture has in turn assisted improving staff morale. The key elements in these projects have incorporated essential patient care that has been taken up by all involved in the journey. Engagement was sought and gained with ward staff, the patients and the multidisciplinary team involving in providing care on 2C, and ward staff have embraced and are utilising the core values of collaboration, openness, respect and empowerment. This was central to the successful outcomes of these projects. Thank you for listening and welcoming us to this special day.